Afternoon and welcome to Seminole County's community update here on June 24th. This is our 2 p.m. press conference. I'd like to thank the media and press for being here to help us get the message out of what's going on in the community here in Seminole County. On behalf of my fellow commissioners in the 7 cities, we're going to try to give you a lot of updates today as things have unfolded. Of course, you're hearing a lot of news of what's going on in the community, the Central Florida region, the state, and of course, nationwide with some of the COVID numbers. And we've got our experts here, our health experts here today that are going to give you that information and talk about that as well. You know, when I started this position as a county commissioner and then the chairman, I never knew that my many years of radio talk show experience would come in so handy in such a format. So I'm thankful for those many years of experience in doing that, as well as our virtual meetings that we hold with phone callers coming in from who knows where, and we don't know who those are. But we also want to talk a little bit today about the economy. Some of you may have seen some of the numbers that were published by the Orlando Business Journal this past week. Seminole County right now is running pretty close to what the nationwide average is, around 14–15%. Our sister counties, unfortunately, because they are relying on more tourist-driven type economies, are close to double what our unemployment numbers are. That said, we know that our business communities continue to hurt. We continue to see people in distress because of their jobs, whether they've either lost their ability to work because their businesses are closed down, or whether they've been reduced to a minimal capacity in order to perform their jobs. What I want to encourage, and many of you business owners have heard me say, long before this opened up, it was very important that you make the community feel safe in order for them to come do business with you. You just can't open the doors and expect everybody to come flooding back in. And those that do come in, you must understand if they don't feel comfortable, they're not likely to either stay or return. So I would urge all of our small business people and all of our businesses in Seminole County, which a great many of them are doing the right thing. If you need help finding PPE, if you need help understanding what you should be doing, pick up the phone, call here at the county at our Emergency Operations Center at 407-665-0000, and we will get you the information you need and help get you hooked up with the things you should be doing, as well as getting you supplies. On that front, we also, this past week, understand from Governor DeSantis that we've now learned some of the monies that are going to come to us here in the county from the CARES Act. As many of you heard me have talked about previously, we never received money direct from the federal government of the CARES Act. It went through the state. The state has now released that. We are eligible for up to $80 million of CARES Act funding, and it's going to be broken down in the following format. We're going to receive immediately $25 million. There will be the remainder that can be given to us in quarterly payments. However, the remainder between the $25 and $80 million, we have to give supporting data in order to get that money. Much different than some of the other counties around the state, which just literally received a lump sum. Now, they also have to support that it's being used for COVID-related items. So with that said, our staff has been charged yesterday at our work session of the Board of County Commissioners. We gave staff direction to do several things. Look at this initial money. We're going to bring in the 7 cities, all the constitutional officers, as well as the court systems, and understand what each of their needs are. We have to audit. We have to do the proper paperwork to ensure that money is being distributed for COVID-related items. Now, that can be for PPE, that can be additional costs for extra help or labor that has had to come in and do things, such as cleaning. That can also be used for community service, as well as business benefits. So many of you know that we rolled out about 2 weeks ago a business grant program, and that was done under our CBDG program. And because of that, we were limited on our funds to about $1.5 million. And there was a lot of restrictions with that because it was based on lower income. So now with the new money that's come in, this initial 25 million, staff will be working for the next couple days on looking at those applications that were originally filed that were not going to be helped under those funds, and look to see what we can do with these new funds and roll that out to help those folks. And the next several days, by first of next week, you should see something come up on our dashboard here at the EOC on our county website for businesses that can apply for additional funding. So we encourage businesses to watch and pay attention to our press conferences as well as the county website as we roll out these additional programs. Additional money will also be utilized for community help in the way of rent, food assistance, utility type assistance for those families that are most at need. Until this money came, we really were limited on what we could do, and my fellow commissioners and myself had actually funded ourselves from the county level to try to help a great deal of these families. So pay attention to that. We urge you to stay on board if you have a need. Now, we're also going to expand this business assistance. If you were applying the first time, you know home-based businesses were not eligible under this new process. We've told staff, make sure that home-based businesses are included and considered in this process. And the whole goal is to get the money out as quick as possible. It's still going to be the original $5,000 amount until we work our way through this. The remainder of the money that we would see from the state, we're really waiting for guidance from the state on really how that has to be handled and how those requests have to be done. As we understand it right now, it's on a reimbursement perspective, which means we will have to give documentation in advance to receive that additional $60 million or close to it. But the initial $25 million has to be used for 100% COVID-related items. And there's a whole litany of descriptions that we can use it for, as well as guidelines, and there's got to be a complete audit trail. So we have told staff we want this to be quick, easy, and seamless. So the application process, staff is working on something that will be very easy. We are also going to bring in some of the business community as well as the Chamber of Commerce to help those business owners who may have an issue with understanding how to fill this out, in giving those small business people that maybe are not as sophisticated as others, understanding how to fill that out. So look for that in the near future. We're dealing with two issues. We're dealing with a health crisis and we're dealing with an economic crisis. The two are running hand in hand. We're going to have the experts up here telling you about the health crisis in just a moment. I urge all of our citizens, please stay vigilant. Remember, young ones, you think you're invincible. Perhaps you are. But the other folks deserve respect in our community, and please respect the elderly and those at risk. That's where our real problem is going to come in. So with that said, I'm going to turn it over to Alan Harris, our Emergency Management Director. Be well.
Thank you, Chairman. Alan Harris, Emergency Manager for Seminole County. I want to talk about a couple items. First, I'd like to talk about some good things. The first good thing is that personal protective equipment is coming in relatively stable now. The supply lines have started to rebound. Just this week, we're going to receive pallets of gowns, medical gowns. We have been severely deficient in medical gowns for assisted living facilities and nursing homes, and they've been critically low, and we're very happy the state of Florida and the federal government has been able to obtain those gowns and get them to us. They were a critical need for us. We have been able to fill N95 mask orders, gloves, those types of items that have been requested by those long-term care facilities, which we know our most vulnerable populations, of course, are in those facilities. So this is a good thing. We've also received some cloth reusable masks that we've been handing out at testing sites, nonprofit, faith-based organizations, and designated communities. So we've been working on distributing those, and we plan to continue those distributions over the next few weeks. So that's a good thing. Our hospitalization availability remains stable. So we can, the hospitals, all three hospital systems, Hospital Corporation of America, Advent Health, and Orlando Health is currently reporting that they can handle the occupancy levels that they currently have, so that's a good thing. But the COVID numbers have gone up in the hospitals. Today we have 56 individuals in our 4 hospitals with COVID positive, that have tested COVID positive, another 49 that have symptoms of COVID and are being tested. So certainly our numbers are up from a few weeks ago where we were seeing 3 or 4. But again, the hospitals have reported that they are okay at this time and have capacity for those individuals. If the numbers go up, then we will have to be ready to act as necessary. Some of the bad things, unfortunately, and if you've looked at our dashboard, you know what's going on. Just yesterday, we had 187 new positive COVID-19 patients in Seminole County, 187. Over 120 already today, where we were averaging at about 2 o'clock, we were averaging maybe 20 a week ago, and about 2 weeks ago, we were averaging 4 the entire day. So a lot more, already over 120 today. We currently, as of 2 o'clock, have a little bit over 1,100 individuals that are currently COVID positive at home, isolating in their home. Over 1,300 individuals are isolating and quarantining because they are have come in contact. So there are some individuals that are isolating and quarantined because they've come in contact with someone COVID-19, and then there's the other ones, which is over 1,100 that are currently COVID positive. We are continuing, of course, our food deliveries. We're continuing to the services that we provide to those individuals. Over the last few months, I've told you that the EOC is calling those individuals every single day. That is just not possible anymore. So we are calling them every other day, and we have them on a rotation schedule. So they know if they need something that they can call us, but every other day they are getting a phone call from us. This is an important time to stress that there is still an executive order in Seminole County that requires individuals that are COVID positive to remain in their house. There have been some incidences where we called individuals and they have elected not to stay in their homes. They've decided to go back to work. They've decided to drive around the community, go to the grocery store, and things like that. We do not, that is a violation of our executive order, and law enforcement will be called when those types of activities take place. We do not want to further the spread of this virus, and that will absolutely do it. If a COVID positive individual with symptoms even is driving around our community, going to stores and things like that, that's very, very dangerous. We have had some exposures in some buildings, and right now Sylvan Lake Park building, the Sylvan Lake Park is still open, but the building itself is closed until further notice. Today we had to close a Central Branch Library due to some exposures there. Though that is scheduled for an enhanced cleaning tonight. Once that enhanced cleaning is complete, the library will reopen tomorrow. We have pushed a public information and education campaign. We believe it's very important to push this campaign, and we hope that people will, by obtaining the information from medical experts, will follow the advice of the medical experts. And that includes what we've been talking about since day one: frequent hand washing, social distancing, wearing facial masks and coverings if you can't social distance, staying home if you're sick. The public information and education campaign does include billboards, paid advertisement on social media, working with the younger population, University of Central Florida, Seminole State College, to do public service announcements, working with the Greek community at UCF, public messaging in Spanish and Creole, and then the distribution of the reusable face coverings, which are taking place at the testing sites and also at various locations and through our faith-based organizations. There's been a large demand for testing. So 2 weeks ago, we had a testing site and we barely had 150 people show up. Today we had a testing site at Lake Brantley High School, which was slated from 10 to 2. The line was closed at 9:45 in the morning because the line was already down the street. So there is an incredible need. There's a lot of individuals that are feeling ill that are calling us to try to get testing. So it's not people that are just asymptomatic. It is people that need a testing site. Our Citizens Call Center is helping those people with identifying a location where they can go. Sometimes that would be an urgent care center, a standalone ER, and just very rare occasions. We are, of course, encouraging the hospitals, but that is more the severe cases. But there are places to get tested, and we can certainly help you identify those places. But the drive-in sites today have been completely sold out. They're completely booked. We have added testing sites. We added a testing site on Saturday. That one actually ended up selling out within about an hour or so. Tomorrow we will launch all the sites for next week. We will have a testing site available every day next week, and in some days we will have multiple testing sites. I want to thank True Health and Allied Health. They're a nonprofit faith organization with volunteers that come out and help to staff these nurses in 90+ degree temperature. So we ask that people be patient out there. It's extremely hot for these medical teams. Even with coverings, the tents and all of that, it's just really, really challenging for those individuals. I can't thank them enough for what they're doing for us, and they continue to support our community. We continue to try to support them the best we can with logistics and other supplies to help them do their jobs. Right now, we're tracking 4 ALFs in nursing homes, assisted living facilities and nursing homes with 2 or more individuals, residents that have tested COVID positive. So enhanced infectious disease control measures are being done there, and enhanced training and training of staff, and then enhanced testing of staff and residents are taking place in those facilities. We're working very closely with the Florida Department of Health for that. And with that, I'd like to turn it over to Donna Walsh with the Florida Department of Health for an update.
Thank you so much, Alan. Some of the information that I am going to provide for you today it might be a little repetitive of what you've currently heard, but I just would like to go into a little bit more detail. Brought the graph with us again today just to show you a visual. You know, in April and May, our community was able to literally flatten the curve. And you can see here just within the last couple of weeks in June that this curve has grown exponentially. This is an example of exponential growth where we're doubling cases every couple days. So far, the Florida Department of Health dashboard reflected this morning over 109,000 cases statewide with 3,281 deaths. Those numbers are changing, honestly, by the moment. So I'm sure that these are not current as of this very minute. Here in Seminole County, the dashboard, again, as of 11:30 this morning, showed 1,624 cases. I understand that those numbers are definitely higher than that at this moment. I'm sad to report that since we last spoke, we've had two additional deaths, and we're very concerned about those, as has been expressed, who are susceptible to complications from this virus. That still stands at our elderly, as well as those with underlying health conditions. Statewide, there's been a report of 1,724 deaths associated with long-term care facilities. So over half of the reported deaths in the state of Florida have been associated with long-term care facilities, which again is reflective of the vulnerability of that population to the complications from this virus. As Alan Harris mentioned, we have 56 current hospitalizations, but a total of almost 150 hospitalizations during this event, and 4 currently in ICU. Our overall positivity rate in all those people that have been tested within our county is 5.3%. Just a few weeks ago, we were getting very close to 2%. We were just about 2.2, 2.3%. Our daily positivity rate is well over 10% every day now. We have tested almost 31,000 people in Seminole County, and those, the testing has, as Alan mentioned, increased significantly. I believe we had 7 or 8 opportunities this week to test. The health department will be starting testing every day by appointment next week, Monday through Friday. We are fully booked tomorrow as well as next Thursday already for testing. So if you will, please contact either the Citizens Information Line at 407-665-0000 or the Health Department line, 407-665-3100, option 1, to find out more information about the testing sites that are available. If you look at the number of cases that were reported in the month of May, we had a total of 117 positive COVID-19 cases here in Seminole County in the month of May. The month of June is not over yet, but so far to date, we've had 1,229 cases in the month of June reported to us. That's 70% of the total number of cases that we have had reported in Seminole County since the start of this outbreak. So significant increases. As far as ages, I know we've mentioned that our younger folks, the age has shifted with those getting infected, and certainly we have seen, as I mentioned last week, as people are getting out and about, we're seeing our younger folks becoming more the ones reported positive. So for instance, 85% of our cases are less than 60 years of age. 36% of our cases are in their 20s. And about 17% of our cases are in their 30s. So between our 20 and 30-year-olds, that's over 50% of our cases. As Chairman mentioned, the 20s and 30-year-olds, they'll probably fare okay, with this illness. There may be some that develop complications, but it's those who you may expose, parents, grandparents, aunts, uncles, that fall into that vulnerable age group, over 65, underlying health conditions that may not fare so well. So please be respectful of those around you. I know the county's campaign is that you wear the mask to protect those around you, and that is truly the case. Certainly with the N95 mask, this is a procedural mask or surgical mask, the cloth mask, are worn to protect those around you. The N95 mask, which you'll see our county medical director wearing, is to protect himself, because that is a hospital grade mask. And that protects him from being exposed to respiratory droplets that could contain COVID-19. He is at risk. He's in the age group. And so we want to make sure that he stays healthy as well. I cannot stress enough the importance that has been mentioned today, the importance of following the infection control guidance, our only defense mechanism, honestly, at this point in time against the transmission of this virus, which is that social distancing, 6 feet or further apart. Wearing the mask if you're going to be closer than 6 feet to somebody. And also, good hygienic practices, hand washing and so forth. Avoid getting together in groups where there's crowding. There's close proximity, and if people are not wearing the protective face coverings in a crowded situation, don't be in that situation, because that's where this virus can spread. So with that, I'd like to introduce our County Medical Director, Dr. Todd Husty, and he will give you more information.
Thank you, Donna. Oops, don't touch me.
I know.
Oh, I shouldn't make light of anything right now. I feel like making light of everything. If people that know me know I'm the eternal optimist. I'm the guy that shows up for work at 7 o'clock in the ER for a 12-hour shift and goes, "Good morning, everybody," and they all go, "Shut up, Husty." Because it's just 7 in the morning. Nobody's that optimistic about things except me. And you're going to hear some pretty pessimistic words from me. You have to understand is that I can't help it. It just is facts. And you've heard a lot of facts lately. You've heard lots of new numbers. You've heard interpretation of those numbers. You've heard contradictory interpretation of those numbers. And my job is to try to help all of us make sense of it. So as an optimist, I can tell you that I've always lived by, I don't get worried very often, but there's that old joke or that old definite joke about being paranoid. Sometimes you're paranoid and sometimes they're really after you. And right now this virus is after us. So the conditions that surround the virus, the conditions that surround the host of the virus. What do I mean by that? The host is us. We're hosting this virus. We don't host this virus goes away. We act as a host, this virus stays. The conditions that surround us and the virus are, we opened up. People went out and partied. We kind of, the psychology of this, if you've been locked up for 2 months and you get let out, you're going to go party. A lot of people did. And they got very close, and what do we see? we see the big spike, huge spike. You could predict, this is a predictable virus. It's just a virus. There's nothing unpredictable about it. You could predict that when we opened up, if you think about it, it's going to hit the younger age groups. They're going to do what they did. I'm not really faulting anybody. I'm not pointing fingers. I'm just saying it's predictable. We're human beings. So we got a lower age group, a lot more in the lower age groups. What can you predict from that? The acuity of the patients that we're seeing, of the people that we're seeing, is less because their acuity has been less as long as we've known this virus, which isn't very long, but it's predictable. So that acuity, that means how sick are people. So how do you measure what's happening? So we wanted to watch the acuity of by hospitalizations to see how many hospitalizations we have. We had so few. We were down to like one person in the hospital for a while. I mean, really just almost nothing. It was so low that it wasn't even a good predictor anymore because it just wasn't telling us much. Well, it's changed. So why would it change if the younger folks that have it have lower acuity illness? Why would we see more hospitalizations? Because it leaks out. This is a reservoir. We're the host reservoir. And it leaks out of our reservoir to other people. How does it do that? 20-somethings. Where do they work? Well, they work in all kinds of places. Some of them probably work high-end business. A lot of them, like my daughter, is a food server. She wears an N95 mask when she serves food with gloves on because she understands, and her dad kind of would yell at her. But she gets it. She and everybody else at that restaurant. So, but a lot of people don't take it that seriously. So they're out there and maybe they're not being as good as that. I was at one restaurant, then another one where people weren't doing that, and I ended up leaving. I can't go there. I'm 68. I don't have a choice. I have no choice in this. I have to be careful. It leaks out. So these 20-somethings might live at home. They could give it to mom and dad. They might have grandparents around. They could give it to them. What if they don't live at home? Well, they have friends. And they're being buddies with their friends. They're out doing whatever they do. And they're close enough and not taking protective precautions, they give it to their friend. Oh, the friend that lives with mom and dad, or the friend that does have a grandparent. It's leaking out of the age group. So you can see the spike in the two age groups, the 20s to 30s and 30s to 40s. But when you think about it, that is temporary. It's a temporary change. So thinking about that, I also heard that the acuity level is lower and that there are people in the hospitals that, because we're testing so much, that are in there for other things, for trauma or a gallbladder or something, that we tested and they turned out positive. So it was stated that many people. Well, I wanted to find that out. So I asked the hospitals to give me some numbers. This was yesterday afternoon. We've never asked for the hospitals to say, how many patients do you have in the hospitals that are there because of COVID, and how many do you have in there that are incidental? They have something else and they don't really have COVID symptoms. So the numbers are actually, so both Alan and Donna reported 50 hospitalizations in the 50s. From the numbers I was gathering this morning and even early this afternoon, it looks like it's closer to 75 right now for hospitalizations. Of those 75, remember I just asked for this, they were scrambling to get this, and I thank them for getting me the information, because if you hear it, it's really important. About 25 of those were not due to COVID symptoms. Oh, about 50 of them were. And of those 50, many of them are having a hard time getting oxygen in. They are the respiratory people. They have real live hospitalized COVID symptoms. That sure is a lot more than we had a month ago. That is important. This is leaking out of the younger population, as you could predict, and it's getting into the older population. By the way, there are 30-year-olds that get this and get really sick, and 40-year-olds, and 50-year-olds, and 60-year-olds. It's not just nursing home patients. I guess I leave you with one last thought. It's about that hosting thing. We're hosting a party for the virus. We are hosting this virus. And we can sit there and say, yeah, well, I'm a good host, I'm not going to argue. Or we can go fighting. And I think we should fight this virus. I think we should not be a good host. We should do the things that we know that stops it. And I don't need to tell you what those are. Thank you.
Thank you, Dr. Husty, and thank all of our medical experts for helping the public understand the health ramifications. I also tend to be an optimist, and I field a great deal of calls to my office and interact with a fair amount of people in our community. And I will tell you that the seniors are extremely worried. You're seeing the impact to the assisted living facilities. You're seeing impact to the elderly population, many of them who are doing the right things and staying home for the most part. So it's very important that, as you've heard reiterated by everyone here today, is although you don't feel sick, you're not sick, you have no symptoms, at least be respectful for the rest of the community. And if you can't maintain your social distancing, please don a mask. You're going to find that a lot more businesses now are requiring, before you can even enter their business, to wear a mask. And of course, we've seen some pictures where some people want to become combative when they're asked to wear a mask to go into a retail establishment. This is not something we recommend. We understand with the impacts of the economy, the impacts of being locked up, that there's some emotional issues that come along with this. So what I want to help assure our community is this also will pass. It will pass with your vigilance and you respecting the rest of the public quicker than it otherwise would. We hear vaccine is the answer. Of course it is. But in the interim, we have to listen to the health experts, do what we know is right, do the proper personal hygiene, and be respectful of the community. If not, your own private business, your employment, the welfare of not only the health issues in our community, but the economic issues are both doubly impacted. So with that, thanks for being here today. We'll take questions from the media for any of the speakers today.
Well, Doc, if I can call you back up there.
Sure.
So, like we've documented, you know, we had a month of May there where it was like 14 a week, 15 a week, 3, 4 a day. Then we got alarmed at, we got 25. We got 31. Then we had like days in a row of 120 and something. Today, 187. I mean, is the alarm bell ringing loud enough, do you think?
You know, the alarm bell is ringing loud enough for probably everybody in this room. I'm sure of it. Is it ringing loud enough for the public to hear? Remember, they've been locked up for a while. They really don't want to hear this news. But anything else is a false narrative. Anything other than the fact that this thing is just bowling over us, everything else is a false narrative. Is it loud enough for everybody to respond? God, I would hope so, but it doesn't look that way.
If they don't?
It's just going to get a whole bunch worse. We're going to be New York.
Dr. Husty, you mentioned there's about 50 people in the hospital numbers that you got today that were there. Do you have the age groups or their ages of those people that were there that were showing the symptoms?
So the question is I said that there are about roughly 50 people in the hospital, according to the hospitals right now, that are there because they're not just positive COVID, they're also symptomatic. Do I know the age groups? And no, I had them scrambling just to get those numbers. I wanted to know more of, so how acute were they? I'll probably be asking them that. They know, the hospitals know that, we've got lots of occupancy. They also know that we are at risk following that curve. The hospitals and everybody else is at risk. They know that. They're jumping through hoops If I ask them to, or Donna asks them, or Alan, they'll jump through hoops to try to get us information to help retrain the public. This is about re-educating. You've got to believe this. You just have to.
And on that note, you were talking about respecting yourself, respecting the community, encouraging people to wear masks. Why not take the next step and mandate mask wearing, whether that's for you, Dr. Husty, or someone else?
So I've been on record before is that I think we should. The question is why aren't we mandating this? I understand there's a lot of issues. Can you even enforce it? I mean, if you have a mandate, can you enforce it? Everybody that has a mandate says it's unenforceable. I am going to argue that, well, then just enforce it with the ones that aren't doing it. And maybe everybody else will get the message. Kind of like the bars. What are we doing with the bars that weren't doing the right thing? They're going to lose their liquor license. Let that be a lesson to the other bars. Well, I think we could do that with masks. Unfortunately, the public really is not, they're pushing back so hard. I don't understand it. Of course, maybe it's because I'm a doctor. I just don't get it. This is not hard to wear, and it gives me freedom to go out and do things. I actually went to Home Depot today. Half the people weren't wearing masks. I had mine on. I've got my little wipe beak so I keep my hands clean and all that. I still don't feel real comfortable doing that, so I'm not going to do it a lot. But yeah, I don't understand how difficult this is. It gives me freedom, and that's how we need to look at it.
Dr. Husty, when you talk about retraining the public, you know, I was at Lake Brantley today, packed. Is that a good sign? Is that a sign that maybe the public is listening and they're getting out, getting tested?
So is the fact that Lake Brantley was packed, and they're all packed, everybody's trying to get a test. Yeah, I think it's a great sign. Of course, I am an optimist, but you know what? That is an optimistic thing. It's very optimistic, is that people are going, wow, this really is going ballistic. It's going exponential, and if we don't stop that, it's horrible.
So maybe for the chairman, Alan, whoever would like to answer this, we've heard from Dr. Husty saying he's for a mask mandate. Why is Seminole County not going to take on a mask mandate?
So I'll be glad to take that. Well, first and foremost, we have a committee that meets and we discuss this. We understand the importance of wearing a mask, but the reality is enforcement. You know, what this is really about is people taking personal responsibility and doing the right thing. And what do we know about Seminole County as a whole historically? They've been good patrons. They've been respectful for the most part. And trying to mandate when you have, I think, sworn officers in this county somewhere close to 400 with a population of 470,000, not including those that cross the border, you simply just can't do it. You don't have the manpower. So, you know, it's similar to what's been discussed is we have laws like a stop sign you have to stop. You get caught sometimes you don't. You have seat belts. We all know we have to wear it, but there's not enough manpower to enforce that. There are, of course, other people that have medical issues that we're aware of that just simply can't wear a mask because they already have respiratory problems. So then what do you get into is you get one community member or citizen now fighting and arguing with another why they're not wearing a mask, et cetera, et cetera. I think that, you know, I respect our community's ability to do the right thing, and that's why we've rolled out this educational program with the billboards, with social media. Some of the CARES money that we've just received is also going to be leveraged to do that. It's going to take place not only in Seminole County, but regionally, all the counties are going to be doing so. So, you know, I'm a fan of something or regulation that can be enforced. I'm not necessarily a fan of something that can't be enforced. Now, look, that said, this is absolutely concerning. And what you've heard is this was not so much unexpected, but we're a little surprised how quickly and how high it went. We're going to monitor this very closely. And the fact that our hospitals are monitoring it and we don't have an overwhelming of the hospitals, we have to monitor this with vigilance and determine what the next steps may be.
A little nuance, though. Obviously I'm out and about, so I talk to a lot of people, right?
Right.
You are going to have a core group that's going to say, I don't care what they tell me, I'm not going to do it. And I think you're right. For them, you're not going to be able to enforce it.
Right.
But then I think you've got a sliver of people in there, and you correct me if you think I'm misreading this, that say, I'm not going to wear one until they tell me I have to, but if they tell me I have to, I will. Is it worth having that in place to get the people who are on the fence to do what you're asking them to do?
Well, and I haven't run into any of those people, David, and the question is, you know, there's some people that believe they'll wear a mask if we tell them to wear a mask, otherwise they won't. You know, I get to interact with the public probably more than I should because of the position I'm in. And I hear all kinds of things. This is a farce. It's really nothing more than a cold or the flu. It's a made-up thing that the government's put in place to kill the economy. I mean, all kinds of conspiracy theories. And then I've heard people say, well, you know, we believe it's a real thing and, you know, we're going to wear the mask. And then I have some older people that say, what are you people doing? I've been through polio. I've been through the swine flu. Nobody's ever told me I had to stay home or ever wear a mask. So this is a new time. And this is, and I think, you know, and I won't speak from a medical perspective, but I certainly am on a lot of calls. But I think what I'm really hearing from the professionals and the experts, there's still a lot we don't know about this virus. I mean, there's a lot of things, like Dr. Husty said, we can predict and are predictable that would have happened. We know it's deadly to those elderly folks or those folks that have immune system deficiencies. But there is a lot that we don't know, and we hear every day. Parts of the country saying, well, it's mutating and getting less here, and we hear, well, it's mutating and getting worse here. What do you believe? Well, what you believe is what the positive tests are and what the hospitals are doing. That's pretty clear data. And, you know, for this group, we will always follow the data and make whatever proper decisions need to be made. Of course, you know, we also communicate and take guidance from the state as well as the federal level. But at the end of the day, you know, I want to have faith in my fellow man that you're going to do the right thing and you're going to be respectful of the community. You're going to pay attention because your livelihood as well as your health depends on it.
Chairman, we were hearing that there may have been a small outbreak at the sheriff's office. Have you heard of that? And if so, in what units?
I have not heard that at all. I mean, I think the reality is, and the experts can tell me, we've pretty much have a community outbreak. I mean, it's through the community. I mean, there's not one part of this community that I think is immune.
We have a number of firefighters who have tested positive. I mean, it's just going to happen. Of course it is. I wanted to say one last thing about my opinion. One guy with 7 of us talk all this out. When you hear the sheriff talk so intelligently about how enforcing things is pert near impossible, and what does that do, and how it sets different individuals in the community against each other, I do back down. But I guess it is my wish, my hope, is that we could get there where everybody was wearing facial covering in public. I'm really asking the businesses to do that. I think we have a better shot at the businesses doing that than we and law enforcement have at doing that. So go to the businesses that are doing the right thing, and you know what to do about the businesses that aren't.
Dr. Husty, how do you feel about students returning to school?
I'm glad I don't have kids that age. What do I think about returning to school? I think right now, at this moment, it is unpredictable because of this exponential growth. So it is a predictable virus. I can tell you that if we don't do stuff, it's going to get worse and worse and worse. We haven't done enough stuff yet. It does take 2 weeks to see the impact. All those people getting tested, all those people, good sign. It's a good sign that people are becoming more aware. And we won't see that for 2 weeks. So ask me that in 2 weeks. I don't know what to predict about what is August going to look like.
Ellen, real quick. We've been talking about a lot of this spike being traced back to Memorial Day parties, pool parties, bars, and all that kind of stuff. But it has been now a period of time since we saw a lot of the protests that were going on. You guys call the contacts of the people who are testing positive. Earlier you had said that you hadn't had anybody say, oh yeah, I was part of a large protest in any community. Is that still the case?
It is. Not a lot coming from the protest at all, which is, at this point, we should have seen it. But you know, when you did look at the protest, though, you know, 70%, maybe 80% did have masks on. It is a good sign that maybe clearly the masks are working. If you look around the country where people are actually doing it, and if you look at the places where people go, I mean, we talked just recently about, Publix has been open since the entire time, right? And there have not been many Publix employees that have gotten sick. Well, why? There have been some, but why? Well, because they're wearing facial coverings, because there's social distancing there, because they put in plexiglass. They've done the things that are supposed to be, done. So I agree. I go into a store. I've gone into a couple stores, and I look around. The employees aren't wearing. I'm out of there. I'm not going back. I'm just not. And I think that business leaders are going to find that out one way or another.
Back on schools.
Back on schools. Uh-oh.
July 20th is the deadline for Seminole's parents to register their students for online virtual learning. Can parents make a valid and a good decision with that deadline in place and not knowing what it's going to be like come school starting?
July 20th is the deadline for parents deciding whether to register for online learning is what the question's about. July 20th is not that far away. It's more than 2 weeks, though. I think we have a shot at figuring out what's happening over the next 2 to 3 weeks. And we have a shot at flattening this thing out. If we do that, I'm a lot more optimistic about August and September. So I just think that right at this moment, I wouldn't bet a nickel on anything right now.
Well, again, thank you for everyone being here today. We're going to move to our Spanish interpretation. Freddie, one of our EOC employees, is so gracious to continue doing this on behalf of the community. And Freddie, thank you very much for doing so. And thank the media and the community. And please stay vigilant. Freddie?
Este es el resumen en español de esta conferencia de prensa en el 24 de junio del 2020. Empezamos con el presidente de la Junta, Jay Zembower, que empezó hablando primeramente de la economía del condado. Mencionó el fondo de CARES Act que el gobierno de Santos anunció el otro día que va a estar dando a los condados que tienen una población de menos de 500,000 personas. Esto incluye el condado de Seminole, que también tiene 471,000 habitantes. Empieza primero dando un 25% de la cantidad, que va a ser $20,500,000 para el condado, y eso va a ser completamente dedicado para el virus o para la causa del condado que le causó a este virus del COVID-19. Después va a continuar a las semanas y meses dando el otro 75%, que va a ser en total $61,700,000. Eso va a ser ayudando a los negocios, a las personas y diferentes lugares que han luchado financieramente con el dinero por la causa del virus, que causó mucho daño en ese caso. Y esto va a ayudar mucho en la economía del condado a cada uno. Van a pronto tener una reunión en el 14 de julio de hablar cómo van a controlar este dinero que van a estar dando a cada uno del condado y cómo lo van a dividir en porcentajes y en grupos, y cuáles son más importantes que otro, cuál se divide de importancia de la causa que este virus causó financieramente. También había el otro fondo el fondo para los negocios pequeños, que estaba un máximo a $5,000 a esos fondos, a esos negocios. Y a la misma vez vamos a estar ayudando a esos negocios que no podían estar aceptados para ese fondo, que podemos usar este fondo para ese tipo de dinero. Después empezó a hablar el gerente de emergencia del condado, Alan Harris. Él mencionó primero lo bueno que el condado está recibiendo es mucho equipo de protección personal para los diferentes lugares de ancianos, y también están dando a muchos lugares como mascarilla, guantes y todo eso de protección. Y también mencionó de los hospitalizados, todavía hay un 20% de lugar para usar para esos lugares. Después empezó a hablar de los malos, que desafortunadamente ayer había se rompió el récord de más casos en un día, que era 187, y en este momento ahora estamos más de 120 en este día. En total tenemos aislado 1,100 personas aislado por el virus, y 1,300 personas que en total, que son unas personas más que también estaban cerca de una persona que tenía el virus y están de precaución aislándose también. Lo que estamos también haciendo es dando una educación para la comunidad en el sentido de lavándose la mano frecuentemente, usando mascarilla y quedándose en casa si se sienten enfermos. También practicando el distanciamiento social. Tenemos diferentes anuncios, estamos haciendo videos provocando para que la gente sepa que usen mascarilla, que se laven la mano frecuentemente y que sigan siendo inteligentes y teniendo precaución por este virus que todavía está en nuestra comunidad. Él empezó hablando de las pruebas, que esta semana puedes hacerte una cita, pero desafortunadamente esta semana no hay más cita disponible para las pruebas, pero mañana vamos a salir con nuevos lugares de sitio de pruebas para la semana que viene. Hace unas semanas que normalmente una línea de prueba era máximo 150 personas, pero teníamos una prueba hoy que empezaba a las 10 de la mañana y ya a las 10 menos cuarto de la mañana cerramos la línea porque había más de la capacidad que teníamos. Mañana vamos a anunciar los nuevos lugares de pruebas para la semana que viene, que pueden ser una cita en prepareseminole.org. Siguiente, también vino la directora de salud, Donna Walsh, que mencionó que de esta mañana a las 11:30 de la mañana había 109,000 casos positivos y 3,281 muertos. En este condado ahora teníamos confirmado de empezar 1,624 casos y desafortunadamente tenemos 16 muertos. En esos números había 56 hospitalizados y en total, desde que empezó estos 149 hospitalizados. Hace unas semanas la tasa era 2.2% positivos de lo que se están haciendo la prueba, y esta semana ha subido a un 5.3% positivo. Vemos que los casos que recibimos en el mes de mayo había un total de 117 casos. Y después en el mes de junio, que todavía no acabamos, ya tenemos 1,229 casos. Vemos que la mayoría de los casos son de los jóvenes y estamos pidiéndole que tengan precaución, que usen distanciamiento social y traten de usar mascarilla lo más que puedan. Vemos que también se está causando muchos grupos grandes que se están reuniendo. Es más probable recibir este virus si estás más en reuniones de grupos grandes, si no estás practicando distanciamiento social, y a la misma vez no están lavándose las manos o no están usando mascarillas si están cerca, más de 6 pies de cerca. Finalmente, vimos el director del condado de Seminole, el doctor Todd Husty, que mencionó que no hace mucho de hospitalizados había bien pocos, casi unos o dos, y ha subido bastante en estas últimas semanas. Un problema que había es que muchos de los jóvenes están contagiándose, pero no son los jóvenes que se están terminando en los hospitales, sino los más ancianos, porque se está llegando de uno al otro en diferentes maneras. Eso porque hay que tener precaución, hay que usar ese distanciamiento social, hay que usar mascarilla cuando se pueda, y a la misma vez lavarse las manos frecuentemente. Vemos que en este momento hay más de 50 personas hospitalizadas por el virus, cuando no hace mucho que había menos de 10. Ahora mismo vemos que el virus se sigue creciendo más y más, y hay que tener más precaución y seguir las recomendaciones del CDC. Si quieren hacer cita de pruebas o tienen alguna pregunta de cualquier cosa, pueden llamar al número 407 665-0000 o a la misma vez pueden visitar nuestra página de internet en prepareseminole.org, que es prepareseminole.org. Gracias.